Hello, my name is Karim Soyan. I'm a fourth year medical student, and today we'll be going through a little scenario where you're going to be put on the spot. Okay, so here is the situation. You're an intern. This is your senior doctor, Dr. Robbie. He comes to you and tells you, "Hey, intern, remember this morning we saw that neurology patient? We wanted to examine his cranial nerves. So I spoke to neurology and they said they're willing to take him in, but they just want us to get some imaging done before they take him in. I really have to go now. I have a very important meeting with the medical director, but get that imaging ordered in, and when I'm back, we're going to discuss it, all right?" And just like that, he's gone, and you are left looking at your order screen with a long list of imaging modalities, and you know you want to look at the cranial nerves, but you're not really sure which modality to choose. But you remember that in medical school you had some excellent tutors that taught you a thing or two about radiology, and in your head you come up with a little schematic of what you could order and why it would be useful. So you remember that, well, generally you could order an X-ray, a CT, an ultrasound, or an MRI. You know that an X-ray is a form of 2D imaging. A CT is 3D imaging. It's just multiple X-rays layered over one another. Ultrasound is like a real-time 3D thing, but it depends on the operator who's holding the probe. And an MRI is another 3D modality. You know that for looking at soft tissue, X-rays are quite poor, but CTs, they get there. They can get the job done, but they're not excellent. Ultrasounds don't look at tissue that well, but MRIs are excellent for looking at soft tissue. At the other end, if you want to look at bones, well, that's the game for X-rays and CT. Those two modalities see bones really well. Ultrasound, not really. Ultrasound doesn't really like bones. Well, MRIs, you're gonna see bone, but it's not as good as it is on X-ray and CT. Well, you also know that X-rays and CTs have ionizing radiation, which is not good. But ultrasound and MRI don't really have that problem. You know about the costs. X-rays are relatively inexpensive. We do them all the time. CTs are a bit expensive. Ultrasound is also relatively inexpensive, and MRIs are quite expensive. The duration for most of these procedures is quite short, but for an MRI it's a bit longer. It's 20, 30, 40, 50 minutes depending on the place you're at. And you know from your anatomy classes that MRI is really the only one that you should be using to look at cranial nerves. When you think about why, you ask yourself a couple of questions. Why do I need 3D imaging for a cranial nerve? Why can't I just use a 2D imaging modality? Well, the answer is because the cranial nerves don't all lie on the same plane. Remember, when you get a MRI or you get a CT or you get one of these 3D imaging, you're looking at multiple layers. You're not looking at only one level. You're looking at all these levels, and the cranial nerves come out of multiple levels, as we will see later, and that's why a 3D imaging modality is important. Alright, MRI and CT are both 3D imaging modalities. Why am I picking MRI? Well, remember, CT is many X-rays layered over one another, and X-rays are really good for bones, not really for soft tissue. While on the other hand, MRIs are known to be superior for soft tissues, and our cranial nerves are soft tissue. Well, what about contrast? Do I need to order contrast? Yes, you need an MRI with contrast because contrast makes it so much easier to identify and examine your cranial nerves for pathology. Oh, so you choose your MRI with contrast, you have made a confident pick, and now you've taken your patient to the radiology department. You've told them a couple of things that you should tell them. This long procedure is going to take you anywhere from 20 to 45, 60 minutes, depending on the machine. The machine is quite small, as you see. It's claustrophobic. They have to be inside this little tunnel the whole time. If they have issues with claustrophobia, you should know that ahead of time. They can't have any metals because of how this machine works, so you have to take the metals away from them. It's quite noisy, so we're going to give you a little bit of noise cancelling earphones just to keep you comfortable. And you're going to tell them there's no radiation with this procedure, so it's relatively safe. And when you inject the contrast, the radiologist or you is going to tell them, when I inject you with this contrast, you're going to feel a little bit of a cool sensation or a bit of discomfort, only for a couple of seconds, and it's going to go away, and this contrast will leave your body in around 24 hours through your kidneys. You're just going to urinate all of it out. And you get your scan, You go back to your desk, and a couple of minutes later, there you go. You get your results. And you're happy. You're going to open your results before Dr. Robbie comes back, and you open them, and you really don't know what you're looking at. You don't remember how to read it. It's not like your anatomy textbooks anymore. It's not annotated. And you're kind of confused. What am I looking at? But luckily, again, for you, you went to a medical school that had very good radiology professors, and you remembered a few things about MRIs. For starters, you remember that MRIs are generally divided into two categories. They can either be T1 or T2 weighted. And aside from why they're T1 or T2, a general way you remember how to identify whether it's T1 or T2 was to look at the CSF, so this fluid, the cerebrospinal fluid inside the brain, and have a little scale in your head that goes from dark to bright, just like your phone's brightness. It goes from 1 to 2. If it's dark, it's T1. So this is dark CSF, it's T1. If it's bright, it's T2. And following that, there will be the other shades of gray to describe what other tissues you're seeing. You also remember that for MRIs in specific, you describe the intensity of the signal. So if something is bright, you call it hyper-intense, while if something is dark, you call it hypo-intense. You also remember that generally for anatomy, you need to know that there are different planes. There's the axial plane, so that's going from top to bottom, like these two. There is the sagittal plane, so that's going from left to right or right to left, so that's your sideway view. And then there is the coronal, which is going from back to front or front to back. And the way many people remember coronal is thinking of coronal as a crown. And when you're wearing a crown, it's going to divide you into a posterior portion and an anterior portion. All right, let me introduce you to my 3 golden rules. Now, these are not rules you're going to see in a radiology textbook or described online. These are just rules I picked up from different resources and different professors that are really going to help you identify your cranial nerves on imaging. Rule number 1. Think 3D, not 2D. The cranial nerves do not appear on the same plane. They appear on different planes. Alright? And if you're thinking about the 2D images you see in your books, it's going to be a little bit hard to identify them. I'll explain that to you in a second. Second, rule of 4s. I want you to remember one thing. At the level of the pons, there are 4 cranial nerves. Above the pons, there are 4 cranial nerves. And below the pons, there are 4 cranial nerves. And they go in order. Above the pons, you have 1 to 4. At the pons, you have 5 to 8. And below the pons, you have 9 to 12. And this rule is very useful. And you're going to see why in a second. Rule number 3. I want you to work 1/3 as hard. You do not need to be thinking about all 12 cranial nerves whenever you see an image. You just need to know what level you're at. Are you at the pons, above the pons, or below the pons? And you can limit your search to only 1/3. You can only look for 4 cranial nerves out of the 12. That way you make your life easier. Right, let's go through these rules. So here's the image you would see usually in your textbook that goes through the cranial nerves all the way from 1 through to 12. And this image has a couple of problems, all right? This image is compressing a 3D structure, this structure over here, into a 2D structure. The second issue with this image is, I want you to appreciate one thing. So most of these cranial nerves arise from the brainstem. And your brainstem is divided into 3 segments, your midbrain, your pons, and your medulla. Your midbrain is called your midbrain because, well, it lies in the middle of your brain, so that makes sense. The medulla is called the medulla oblongata, which connects and continues down as your spinal cord, so it looks like a tube because it continues down as a tube. And the pons, well, it looks sort of like a P, and that's how many people remember it. It looks like a P, so the pons is the bulging part, which looks like a P. And that's your brainstem. Well, if I bring your attention back to the 2D image, well, you see your medulla, you see your pons, the bulging part, but you don't see the midbrain because these images in your textbooks do not show you the midbrain. It's hidden, and the midbrain is actually hidden below the pons here, and a few cranial nerves arise from it. But if you just look at this diagram, you're going to think those cranial nerves, which are cranial nerves number 3 and cranial nerves number 4, they come out of the pons. They do not. They come out of your midbrain. And we're going to discuss that in a second. So I always want you to think 3D. Right over here at the top, that's the top of your brain, and all the way down here, that's the bottom of your brain, and this is your brainstem where most of your cranial nerves are going to be coming out of. All right. All right. Rule number two, rule of fours. Let's take the brain. Let's take the brainstem, like we described, the midbrain, middle of your brain, the medulla, the bottom, and the pons looks like a little P. It's the one in the middle. And we're going to split things around the pons. You're going to have 4 cranial nerves at the pons, 4 below the pons, and 4 above the pons. Now, above the pons, what do we have? We have the midbrain and, well, the rest of the brain. And there's only one rule you really need to know here. That is that cranial nerve is 1, cranial nerve 2, cranial nerve 3, cranial nerve 4 don't all come from the midbrain. They just come from above the pons. Cranial nerve number 3 and 4 come from the midbrain. Cranial nerve number 1 and cranial nerve number 2, they come from a little bit higher, not the midbrain, but they do still come from above the pons. So this is a useful rule to remember. At the pons, you get cranial nerves 5 all the way to 8, and at the medulla, you get the rest. You get cranial nerve number 9 all the way to 12. Just take a second, look at this diagram, and remember it. It's going to be very useful for you. Now, if we bring the rule of fours and connect it to the 3D thinking that I described earlier, I highlighted to you some things in brown and where you would find them, some things in green and where you'd find them, some cranial nerves in red and where they originate from, and some in purple and where they originate from. And now, when you look at this, you can appreciate the 2D and the 3D, and you can understand which cranial nerves come from which part of the brainstem. Again, it's going to be quite easy for you to remember because all you're going to do is just thinking about fours, and if you forget, just count from 1 to 12, and you're going to get there. All right, rule number 3, do just a third of the work. Whenever you look at a slice, you do not need to be thinking about every single cranial nerve. You just need to be thinking about a few. Okay, so you ask me, how do I know what level I'm at? Well, luckily for us, the brainstem on a cross-sectional image looks very different depending on where you take that cut from. The midbrain, the top of the brainstem, has a very characteristic Mickey Mouse kind of appearance. It has these 2 ears, has this kind of circle. It looks like a Mickey Mouse, even anatomically speaking. If you flip this image, it looks like a Mickey Mouse, and that's how a lot of people remember what they're looking at. If you see this, you're at the midbrain. What about the pons? Well, the pons, I want you to imagine a big circle over here, a big ball, and it's connected by 2 cables from 2 sides. When you see these 2 huge cables connecting the right and left side of the brain, just know you're at the pons. You're not going to see this above or below. This is a characteristic sign of the pons. The medulla, remember, we said this continues down as the spinal cord, so it just looks like a tube. On your imaging, it's just going to look like a tube. It's just a circle. It's not a Mickey Mouse. It's not cables. It's just a circle. When you're able to identify where you're at, then you kind of can make it easier for yourself to know what cranial nerves you're looking for. You're looking at the midbrain. Well, you know that at the midbrain, there's only 2 cranial nerves that come from there, your cranial nerve number 3 and your cranial nerve number 4. At the pons, you know you're only going to see 4. You're going to see either cranial nerve number 5, 6, 7, or 8. And if you see the medulla, you know you're only going to see 9 through to 12. That way, you cut your work by a third, and it makes your life a lot easier. Right, let's put that into practice. We're going to start from the top of an MRI here. We're going to go a bit lower, and as you see, as we approach the brainstem, you're going to see the very classic Mickey Mouse appearance. That's how you know you're at the midbrain. You go a little bit lower, you're still at the midbrain. You start seeing that bridging appearance, the 2 big cords on either sides. You're now at the pons. And you're still at the pons, and now you see the circular appearance, the tube-like appearance. You're now at the medulla. And you're still the medulla, you're still the medulla, you're still the medulla. Now if we go back all the way to the top, you see your eyes where you're going to see your cranial nerve number 2, and you see your nose where you're going to see your cranial nerve number 1. All right, let's go back to our patient and let's apply all that we've learned, our rule of fours, our thinking in 3D, and identifying what level we're at, working in 1/3. So let's orient ourselves. This is an axial view of the MRI we're going to be looking at. This is a supplementary sagittal view showing you a yellow line, which tells you what section you're at. The current yellow line is showing you that you're above the pons, you're the midbrain, and you can confirm that because you can see the little Mickey Mouse appearance here to confirm that you are indeed the midbrain. We're going to look at where your nose is supposed to be. You can obviously appreciate your eyes are here, so your nose is here. And if you look at this hypo intense, so the darkness, the dark line here that I'm pointing at, it's at the edge of my pointer. That dark line would be your olfactory nerve. And you know that based on the anatomical location, you know that based on the location in relation to the pons, and you know that based on the location in terms of the nose. Alright, so we're still above the pons. This is a different image. And now we're going to look for cranial nerve number 2, your optic nerve. So your optic nerve obviously is connecting to your eyes. You're going to look at your eyes. You're going to look at the hypo-intense structure connecting your eyes. And you can appreciate over here that this is your cranial nerve number 2. Alright. And remember, cranial nerve number 1 and 2, they don't originate from your brainstem. They originate from a bit higher up. You still will see them at the same level as your midbrain, but they do not originate from the midbrain. What does originate from your midbrain is your third cranial nerve, your oculomotor cranial nerve. And as you see here, coming out of the ears of the Mickey Mouse, these two hypo-intense lines, these two structures over here, these are your oculomotor nerves. Okay, so what about our trochlear nerve? Where are we going to see the trochlear nerve? So while the oculomotor came from anterior to the midbrain, the trochlear nerve starts at the posterior section of the midbrain. So it comes from the bottom of the Mickey Mouse, from the bottom of the face of the Mickey Mouse. And you can see the start of the trochlear nerve here, cranial nerve number 4, at this hypo-intense, this dark line at the bottom of the Mickey Mouse. But it's kind of hard to appreciate the starting portion of the trochlear nerve. Luckily for us, the trochlear nerve does not stay here. It originates here, but it continues and moves anteriorly. And if you look here at these dark structures, we just scrolled a little bit. We're still above the pons. We just scroll to a different segment, and you can see that this cranial nerve that comes at the midbrain, originating from the back, coming to the front, posterior to anterior, this is your trochlear nerve. Let's scroll down a little bit further. Now we're done with the midbrain. We move to the pons. And we know we're at the pons, because the yellow line tells us we're at the pons, but if we didn't have this yellow line, it's because we see the classical bridging appearance. Remember, your two big cables bridging the right and the left sides of the brain. So what were we looking for here? We're looking for cranial nerves number 5, 6, 7, and 8. Cranial nerve number 5, your trigeminal nerve, it branches into 3 different branches, but I'll say that's outside the scope of this video. For now, we just want to identify the main branch of the trigeminal nerve. And coming from the sides, this right here, this is your trigeminal nerve. The trigeminal nerve comes out of the sides of the pons, roughly at the midpoint. Right, so this is just another view of the trigeminal nerve. Just remember the trigeminal nerve is a massive nerve, and that's why it splits into 3 different subnerves. And you're going to see it at many levels of the pons. It's always going to be coming out of the sides of the pons, roughly around this area. That's how you know your trigeminal nerve. It's a large nerve appearing at the region of your pons, and you're going to see it on multiple sections. A little bit harder to appreciate are your cranial nerves number 6, 7, and 8. Remember, these are not as big as your trigeminal nerve. They're a bit harder to see. We're still at the level of the pons here. We're approaching the bottom of the pons. We can no longer see the trigeminal nerve here arising from the sides, but we do see 3 hypo-intense structures arising from the pons here. One over here, and another one right next to it. Luckily for us, anatomists made this quite intuitive, and the order of numbering of these cranial nerves goes from the middle outwards, from medially, laterally. So the ones that are most medial are the earlier numbers. So this is your cranial nerve number 6, the one closest to it, right next to it, the next hypointense structure, that's cranial nerve number 7, and the one furthest out, that's your cranial nerve number 8. So that's your abducens, that's your facial nerve, and right next to it, that's your vestibulocochlear nerve. They go from medial to lateral. A bit harder to appreciate. You can go through an actual MRI and scroll through them. I'll leave you a QR code at the end of this PowerPoint so you can scroll through. Be a bit easier to identify, but if you're at the level of the pons, you no longer see your trigeminal nerve. You only see these dark structures arising from your pons, go from the middle outward. The one closest to the middle, that's going to be your cranial nerve number 6. Right next to it, the nearest one laterally, that's cranial nerve number 7, and the one right after that is cranial nerve number 8. Alright, so we're approaching the end. We're done with the midbrain, we're done with the pons, and we're now at the medulla. How do we know we're at the medulla? Well, it's now starting to look more like a cord. It stopped having that connecting bridge appearance. You can see the bridge starting getting disrupted. So now we have reached the medulla. And what's the first cranial nerve we're going to see at the medulla? Well, it's cranial nerve number 9. It's the glossopharyngeal nerve, and you can see it arising here anteriorly. It's arising anteriorly. It's this structure over here. Just take a moment to appreciate it. It's the hypointense structure arising from the middle. So we scroll a little bit lower and you look at this initially and you think, well, this looks like we're at the exact same location. But a very unique thing about the cranial nerves that appear from the medulla is they all appear at relatively different levels. So while we were looking higher up on the previous image, that was your cranial nerve number 9, your glossopharyngeal. If you go a little bit lower and you look at the same location, this cranial nerve now is the next in line, the famous 10th cranial nerve, the vagus nerve. In an exam setting, if you're wondering, they're not going to trick you and tell you, is this the vagus, is this the glossopharyngeal? They're going to give you one or the other. It's very hard to be able to tell if you cannot move your image up and down. But if you're able to move the image up and down, like on a real MRI, the one that appears above, that's your 9, and the one that appears below, that's your 10. Alright, next up in line, cranial nerve number 11, the spinal accessory nerve, also known as just the accessory nerve. This one is a lot easier to spot, right? So you're clearly now approaching the spinal cord. You no longer see all the other structures we were seeing earlier. You can no longer confuse this with, is this the pons, is this the midbrain? This is clearly the medulla. It's a circular appearance. You see a big circle, you see a small circle. A big circle, you see a small circle on this side. This little dot over here, that is your spinal accessory nerve. The bigger one, that is a vessel. I don't want you to focus on that right now. The little one is usually the nerve, and that is a rule that's true for most anatomy. In most, not all anatomical pictures, you're going to see the vasculature is usually bigger than the nerves. So the big one, that's your vasculature, and the little one, that's the nerve. So that's your spinal accessory. It goes down, and you can see it very easily. It's the only cranial nerve you can see at this level. All right. Well done. You have reached the end of the scenario. Dr. Robbie came back. You reported that your cranial nerves were absolutely perfect. They were all intact. And you can admit this patient to neurology now. The neurologist is very happy with you. Might even get a neurosurgery residency now because of your brilliance. But back to reality now. I've left you the QR code. You might have noticed we did not do cranial nerve number 12. We did not look at hypoglossal nerve, and that was by design. I want you to go to the site. I want you to scan the QR code, and I want you to scroll through the MRI as we have done in this video. There is an annotations on mode and an annotations off mode. Look at them with the annotations. Try to remember the rules we shared. The rule of force. Think 3D, not 2D. and make your work a lot easier by only thinking of the cranial nerves you're meant to see at whichever level you're looking at, and look for the hypoglossal nerve without annotations and see if you can get it correctly. I hope you've learned a thing or two from this video. I wish you the best of luck for your assessments. If you have any further questions, you can always contact me by email, or you can get through to one of the radiologists. Dr. Rani and Dr. Rashid will be more than happy to help you as always. And thank you for listening.